So what I'd like to talk about now is the unifying factor between chiropractic, osteopathy, acupuncture, spondylotherapy, and all kinds of soft tissue therapies like trigger point therapy. That connection is neurology, and that connection is the spine. So chiropractors, they like to move the spine. Osteopaths, they worry about that too. Spondylotherapy was developed by MDs in the early part of the 1900s. Now, they were built on the foundation developed by Sir Henry Head, who discovered that when the internal organs were irritated, they had manifestations of pain and tenderness on the front of the body. These were called Head's zones. Currently, they are used in France, Germany, Spain, as part of trying to figure out what might be wrong with somebody. The spondylotherapy people, they didn't care about the position of a bone, they cared about stimulating the spine. And so what they did is they used percussion methods, utilizing a reflex hammer to gently tap over the spinous processes. And when they did that, they felt that they were able to discern change in the organs that were innervated, the muscles that were innervated. And so what I would be advocating now, I can't test internal organs, but what I find when I tap the spinous processes is I find that these soft tissues that are controlled by that area, or that it controls rather, they develop much less tension and tone, and their range of motion increases. So my hypothesis, the common link between myofascial problems and the spine can be dealt with by tapping the spinous processes. That decreases the tension in the muscles. It allows the muscles then to be treated, which these are areas where we like to put acupuncture needles. In acupuncture, they put the needles along particular meridian areas that are again named for the internal organs. And if we treat those same areas, I believe we can have the same effect as acupuncture might have. Now, that doesn't mean that we should go around and say, I am going to treat the liver now. But what it does mean is that we can support that. We can use spinal tapping as a complementary modality for everything else. And we're going to demonstrate that right now. Okay, so before we do any treatment, we want to go ahead and see what the range of motion is to start with. So we're going to check with the cervical motions. We're going to turn to the side, and we're going to turn over here, slightly less than perfect. And then we're going to come over, and again, slightly less than perfect. I usually measure this with finger breaths from the ear. And can you bring that chin down to here? Okay, I can get 2 fingers in there. So that's how flexible that is. We're going to check out the bicep now. We're just going to do one side. I'm going to pull back, and this is where she stops. We're going to check the lat. Ideally, I would like this to be way behind the ear. And then we're going to look at the serratus anterior. And again, I would like that elbow to come at least to the midline. It looks kind of like we have wings here. Okay, on your side, please. Head up here. Now, we're also going to check out the quadratus lumborum. I'm going to put a hand here. I'm going to pull back. Okay, and ideally, I like the shoulder to touch the back of the table. Okay, and then we're going to take here and here. I'm going to check her psoas. This is neutral. I should be able to pull back almost 45 degrees. And I'm not really getting a chance to pull back. And I've elevated the thigh to try to take out and check just the TFL. All of that's tight. So with that, let's have you sit up now and face this way. And lean over the toes. Drop your head and lean forward. There we go. Okay, now what we're looking for here is I'm looking for areas of spinal flattening. We have an area right here. This goes from about T3, I'd say, to T5. And then as I keep going down, okay, she does not have a secondary region, so just one area here. Now what we're going to do is we're going to practice some tapotement here with a little piece of plastic covering the spinous process, one reflex hammer, and then I'm going to tap. I like to do 10 at each section. Okay, now that has definitely rounded out. Now go ahead and face back towards the camera. And we're going to check the range of motion and see if anything has happened. I think I like that a whole lot more. Definitely better. And we're going to take and check out the bicep. Okay, bicep is big difference. Thumb up for the lat. We are considerably behind the ear. We're going to put the hand here, check out the serratus. We are definitely going past the rib cage now, so we're not perfect, but we've made a difference. On your side, please. And we're going to check out the quadratus. Okay, a little bit of a change. Yeah, she wasn't expecting all of this. Okay, and we're going to check out the psoas. No idea what's going to happen, but let's see. We actually do have a little bit of motion back. Let's take out the TFL. So more work needs to be done with the psoas, but all we did was tap some thoracic vertebrae. Go ahead and sit back up. So this is what can happen with spondylotherapy, just that tapping of the spinous processes. It helps to work and integrate chiropractic, spondylotherapy, acupuncture, and trigger point therapy. Thank you so much for watching.